crew and I have been dispatched to a single motor vehicle accident. The car is rolled over. There appears to be the driver about 60 feet away. We have determined that the scene is safe. We do not need any other assistance on site. We're wearing the correct PPE. The probable mechanism of injury for the patient is being ejected from a car. As we walk up, we notice the 45-year-old male laying down, no acute distress. He appears to be breathing spontaneously, no acute fractures or bleeding at this time. My assistant will maintain in-line cervical stabilization due to the mechanism of injury. We will determine the level of consciousness of the patient, whether they're alert, respond to verbal stimuli, painful or unconscious. I will perform a modified jaw thrust maneuver to be able to assess the patient's airway for any obstructions, like blood, vomitus, cracked teeth. We'll do a look, listen, and feel to make sure that the patient is breathing, see about the depth of the respirations, whether it is equal and unlabored. If the patient requires any mechanical assistance in breathing at this time, the appropriate airway device will be placed and the patient will be ventilated by the person who is at the head. We will be checking the carotid pulse, checking the radial pulse. We will be checking for rate, rhythm, and quality. We will also check a capillary refill on the hand. Whenever we are assessing the patient, we are also assessing the temperature and of the skin. We are also checking for moisture level. We will then perform the assessment for any bleeding posteriorly, checking our gloves, both sides, both arms. We will then get a full set of vitals to determine what the baseline status of this patient is. I would expose as much of the patient as we can. We will now go on and perform a more thorough assessment of the patient. The maintaining the cervical alignment is still occurring. We will be checking for any open areas. We will be looking for drainage or battle signs out of the ears, checking for CSF fluid, checking for any step off in the neck, in the cervical region, making sure the trachea is midline, looking for jugular vein distension. We can also press on both sides of the patient around their eyes, their nose, jaw, and checking to make sure everything is stable. Checking on the shoulders, upper chest, sternal discomfort. We can also check the pupils, may see if they're equal and reactive to light. Come through and check the heart rate for the rhythm and the quality. Also checking the breath sounds, seeing if we hear presence or absence of breath sounds in all the pertinent areas. Expose the abdomen, see if there's any trauma here, palpate, see if there's any discomfort. Check the pelvis, push inward, see if there's any discomfort, any movement. Check the genital region with a quick scan, see if there's any fluids, any overt trauma to the area. Check both legs for stability of the femurs and the lower legs. See if the patient is able to press down or pull up on either one of the feet. Would want to also check for pedal pulses to make sure there's adequate circulation to the feet. Would also like to check both of the arms, checking for any fractures, checking for capillary refill. Can you squeeze my hand? Can you pull me towards you? squeeze my hand. And also we're assessing whether the patient can follow commands. I'd also want to make sure that the grips were equal. If they were not, this could be a stroke. Make sure the patient has sensation in the legs. If they don't, possible spinal cord injury. We would then want to check the patient's back. We will do a log rolling technique. Before I move this patient, I would like to make sure that we have a backboard ready so that we don't have to move this patient more than once. So we can log roll them. I could come, feel their spine. I can auscultate their lung sound, see if they're clear, have the backboard placed, roll them down. We can then start strapping the patient in and get them ready to go. If the patient became more alert, I could start asking them questions, or if any bystanders arrive, I'd want to know if there's any other signs and symptoms that the patient is having as far as chest pain or discomfort anywhere. Would want to know if they're allergic to anything. I would also, during my assessment, check for medical ID tags. I'd want to know what kind of medications the patient was on, pertinent past medical history, when was the last time they ate, and if they had any understanding about what led up to this event. After our initial rapid exam, we would have that full set of vitals. I would take another set so I can compare to see how the patient is doing. If the patient does not become more alert, I would determine them quite critical, and we need to go to the ER as quickly as we can.